and entertain.
Asanda and Peter bring you Rise and Shine.
Weekdays, 6 till 9 a.m.
Central African Time.
Right, now let's take a look at this story. A new major study has revealed a staggering statistic. Over 3 million children worldwide have died in 2022 due to infections linked to antimicrobial resistance, or AMR, which occurs when bacteria, viruses, fungi and parasites evolve, rendering medicines like antibiotics ineffective. Now, the findings published by experts in global child health are stark warning about the growing threats of AMR and what it poses, particularly to children and low and middle income countries. Well, to unpack the scale of the problem and what must be done, we're now joined live from Australia by Professor Joseph Harwell, who's a Senior Clinical Director at the Clinton Health Access Initiative and co-author of the study. Thanks very much indeed for joining us, and welcome to the program, Prof.
No, thanks for having me.
So describe for us a little bit more about the scale of this crisis. Over 3 million child deaths in 1 year due to AMR-linked infections. I mean, this is staggering. How did we get here?
Well, what we did was estimate what we think the rate of AMR-associated mortality was in children. And there is some uncertainty as to what the actual number is, but we feel pretty confident that the number is high, and 3 million is going to be close to what the actual number is. AMR has been a problem for children for a long time, but we just don't have really good data on the magnitude of it, and that's why we wanted to focus our research efforts particularly on children here, because children are much more vulnerable to adverse consequences of antimicrobial resistant infections, and if we don't know what's going on, then we can't respond.
All right, so what we know is that this study highlights the low and middle income countries hardest hit. Why are children in these regions particularly vulnerable to AMR?
That's an excellent question, and again, some of it gets back to the adequacy of the data. In places where you have really good surveillance, it's easy to see when you have a problem and you can intervene. The surveillance, particularly in South Africa, in Southern Africa, is not very good. And what we did was we took advantage of some commonly available, publicly available data sets to look at what we think the rates of resistance are in the countries where we have reasonably good surveillance, and the rates of resistance in Africa were very high. We also saw very high rates of resistance in Southeast Asia as well. And so we used the mortality data and the resistance data and the antibiotic use data, along with mortality and demographic data that's available all from a variety of different websites and databases. And we compiled some evidence to try to understand the magnitude of the problem and where it was.
All right, so what are some of the preventable factors contributing to AMR-related deaths in children? Poor sanitation, misuse of antibiotics, underdiagnosis?
Well, antimicrobial resistance is a multifaceted problem, but resistance really develops from antibiotic use. It can develop even when antibiotic use is appropriate, but in perhaps 50% of the time, 50% of the cases, antibiotics are not used appropriately. So this is, I think, where we can have the most control. Humans are exposed to antibiotics that are also present in our food and in the environment, and inappropriate use of antibiotics in those contexts, in animal food production, in poor waste management. Those also expose people to antibiotics and can lead to antimicrobial resistance. So there's this concept in the AMR field called One Health that recognizes that the health of people and animals and the environment are all intertwined. And when antibiotics are present, that will expose the bacteria that are in the environment, in the animals, and in the people to antibiotics that can lead them to develop resistance.
So, what does this study tell us about the state of pediatric care and infection control globally, and specifically in Africa?
Well, there is a concern with these rising rates of resistance that our ability to treat even common infections are going to be is going to be under threat. I think that in low and middle income countries such as in Africa, the ability to respond is impaired by the availability of evidence. And so that was one of the reasons why we undertook this work, was to improve access to the evidence. If you don't know whether your rates of resistance are high or not, you might be tempted to respond by using medicines that are broad spectrum, that could kill everything. Alternatively, if you go on and use the medicines that you've always used and there's a lot of resistance, then you could have some more negative consequences. And so we really need to have more information to help us understand how to respond, and then to see if the way we respond is effective or not, looking at that evidence over time.
Can you explain to us how antimicrobial resistance spreads? I mean, is it just a hospital issue or a broader community issue?
Yeah, that's an excellent question. So hospitals are where antibiotics get used a lot. That's where sick people go and are given antibiotics. But antibiotics are also used quite a lot in communities. And so perhaps the most highly resistant bacteria live in hospitals, and hospital-acquired infections do tend to have higher rates of resistance. But over time, those bacteria that live in hospitals diffuse out into the community. And so increasingly, we're seeing types of resistance that ordinarily we only saw in hospitals appearing in the communities as well. And again, if you have data, if you can do surveillance to pick it up, then you would recognize it early. But in most cases, these things are happening without, adequate information to tell us when it's happening and where. And so figuring out where it is and the magnitude of it is really important from a policy perspective.
There are some growing concerns that AMR could reverse decades of medical progress. Are we heading towards a post-antibiotic era, maybe, where routine infections could become deadly again?
Well, that is certainly the concern. I think when bacteria are resistant to every antibiotic we have, even common routine surgeries, treatment for cancers, where the complications are often infections, but we've been relying on being able to treat those infections. A lot of medical progress could be threatened. Increasingly, people are having artificial joints implanted. They are having intravenous catheters, lots of surgical procedures that would ordinarily not be such a big deal. If you develop an infection that does not respond to antibiotics, that could potentially be life-threatening. I don't think we're at a point in history that we can say it's a pre-antibiotic era anymore. We've been doing a reasonably good job of developing new antibiotics. Unfortunately, those antibiotics are expensive, and in order to be able to use them properly, again, you have to have information. So there is a concern that if we ignore this problem and don't do what we need to do to contain it, that the measures that we've taken to try to combat it will not be effective in many cases.
Okay, so with that in mind, how can African governments and health ministries respond more effectively, particularly with regards to AMR in children?
Yeah, so there are a number of ways to respond. The first is, I think, to strengthen surveillance systems so that we have adequate data to help inform our treatment guidelines and protocols. And in South Africa, at least, the surveillance systems are reasonably good. And so
Hello, Prof, can you hear me? Hello? All right, it looks like we may have lost the line there to Australia, and we've been speaking about AMR, antimicrobial resistance, which is a fascinating subject. We take it for granted that everything is going to end up well when we get to hospitals in particular, but not always the case. And that was Professor Joseph Harwell, who's the Senior Clinical Director at the Clinton Health Access Initiative, talking to us. But it's not a lost cause. We do have hope, and we have to hold on to that.